Welcome to Spectrum Health Gerber Memorial. Our goal is to provide you with competent, compassionate care. This video will guide you through the surgical experience.
This is Kathy in pre-op, and I'm just
Before surgery, our preoperative educator will phone you at the pre-scheduled time to review your medication list and anesthesia questionnaire. You may be required before your surgery day to come to the hospital for lab work and an EKG of your heart. This will ensure us that you are in the best condition for surgery and that you are free from infection. All surgery times are approximate because emergency cases may unexpectedly be added, or current surgeries may run longer than expected. Cases are sometimes completed earlier, in which case we may be able to start your surgery earlier. Please be available by phone the day of your surgery so we can advise you of any changes. Before you arrive at the hospital for surgery, please follow these guidelines. Have nothing to eat or drink after midnight the night before. Take only the medication listed by the preoperative educator. Remove all makeup, nail polish, and jewelry, including any body piercings. You may sometimes leave your rings on, as long as this is not the area upon which you are being operated. Wear comfortable clothing. Have someone with you to drive you home and someone to stay with you at least 6 hours after you are home. To ensure your surgery readiness, we may ask you to have a lab test when you arrive. The most common lab tests ordered are urine pregnancy, potassium levels, blood type, and complete blood counts. Once your blood has been drawn, you will proceed to outpatient surgery, where our team of nurses will be waiting to prepare you for surgery.
Hi, how are you? Good, how are you? Good. What are we doing today?
A knee arthroscopy.
The outpatient surgery nurses will take your blood pressure, pulse, and temperature. They will also ask questions about your health and will also review your medication list. We will start an IV and may apply compression leggings. Your surgical site will be confirmed and marked unless the site is on your trunk.
Good morning, Mrs. Stevens.
Good morning.
Are you ready for surgery?
Yes.
We'll be getting started in just a few moments. Do you have any questions? I know we discussed this in the
Your
office.
surgeon will stop in to see you before you go to the operating room. This is the time to ask him any last-minute questions. He or she will initial your surgical site. The nurse anesthetist will interview you before you go to surgery. At this time, he or she will explain your plan of care and answer any questions. He or she will also initial your surgical site. Your operating room nurse will take you to surgery. You will be asked your name, date of birth, and whether or not you have any allergies. In the operating room, we will connect you to monitors, and the anesthesia nurse will oversee your condition throughout the surgery. If the surgery is to be lengthy, we may insert a catheter to drain your bladder. Your family will be kept informed of your condition. You will be kept as comfortable as possible during the entire procedure. You will be watched very closely, and your blood pressure, your oxygen levels, your pulse, and your breathing will be continually monitored. The nurse will also confirm what type of surgery you are having and mark your surgery site.
Stevens, her birthday is 8/11/1972. She's here for an arthroscopy of her right knee. She received 1 gram of antibiotics prior to surgery. She has no illness.
You will be given oxygen as you awaken from the anesthesia. We will also provide pain medications to help manage your pain. If you had a general or a spinal anesthetic, you will be taken to the recovery room after your surgery. After your recovery period, which may be anywhere from 30 minutes to an hour, you will be taken back to outpatient surgery, where you will continue to wake up. Your vital signs will be monitored by the outpatient nurses. Before you go home, the nurse will review discharge instructions specific to your type of surgery with you. All surgeries are painful. The type and amount of pain depends on the procedure and the individual's pain tolerance and experience with pain. Remember to get your prescriptions filled before you go home. We would be happy to call the pharmacy for you. Take your pain medication regularly for the first 48 hours. Follow your surgeon's recommendations for activity restrictions. Some days you may feel great and go over your activity limitations. Do not overdo any activities, as this may cause more pain and fatigue and delay your healing. Drink plenty of fluids and increase fiber in your diet by increasing fresh fruits and vegetables. We thank you for choosing Spectrum Health Gerber Memorial, in which you have your surgery. Our goal is to make this experience as comfortable and safe as possible, so that you may return to the activities of living you enjoy.